Today we have a very special guest. This is someone that I'm so excited to have on because there's such a strong connection between gut health and our brains and our emotions. So I just love talking with people in the counseling and psychiatric world. And today we have Chau Lee, a psychiatric nurse practitioner, joining us. So welcome.
Thank you. Thank you for having me. I'm so excited to be on your show. I love what you do.
Thank you so
Excited
much.
to learn from you. Yeah.
So tell us a little about yourself.
Yeah. I have been a nurse for about 10 years, and I've been a psychiatric nurse practitioner for 7. I've worked in different settings, primarily nonprofits, but I decided to open my own private practice so that I could specialize in women's mental health, particularly, because that's my passion. I've just been involved with women's mental health for I don't know how many decades now. And this also stemmed from my own personal experience with postpartum depression and anxiety after I had my 2 kids. So just a little bit about after I had my daughter, I had postpartum depression. I just remember feeling such sadness and so alone. And I didn't seek help at that time. I just powered through it. I feel like so many moms do because you're so busy. And I wish I hadn't. I just lost a lot of valuable bonding time, I feel like. And then a couple years after that, I had my son, and then I experienced postpartum anxiety with him. But with him, it was different because I sought help from a therapist. I was able to utilize my professional knowledge and more holistic intervention. So that really helped me. And so that's what brought me here today to open my own practice so that I could spend more time with women and just allow them to have a safe place to share what they're going through. And so just providing more time that they probably wouldn't in their maybe regular doctor's office. So that's where I'm coming from. At my practice, we use an integrative and holistic approach. Basically, that means I like to take into account a person's mind, body, and spirit, not just like, what are your symptoms? I like to deep dive into that. And so I'll go through things like their diet, of course, which is huge, their sleep, the stressors they're going through, their physical activity. I try to go through all that and see if we can maybe optimize or modify things in their life before even considering medication. I primarily diagnose and prescribe medication, but I like to consider all those things first before even going there, and even try vitamins, nutraceuticals also. So that's a little bit about myself and my practice.
I love that because that's how I see my practice as well, as far as, coming from the standpoint of taking the time to look at the whole person, how the body systems work together, the mind and the body. But I would say where my weak point is, I deal mostly in the physical. So when it comes to their mental health, their emotional health, I know I do try to teach my clients how strongly that connection is, but there's an extent to which that's just not my expertise. So that's one of the reasons I just love that we're talking about this today so we can benefit from your expertise. So we're talking about, I keep mentioning the gut brain connection and what a strong connection there is. So I work with, and it's a great connection with you too, because most of my clients are women. I'd say I specialize in IBS and SIBO or other functional digestive issues, and 2/3 of people with the IBS are women. So I do have mostly women, although I have men as well. And the gut and the brain are very strongly connected. There's a nerve called the vagus nerve, and it goes both ways. So it allows our brain to communicate with our gut and send messages to our gut about digestion and mood and other things as well. It also allows our gut to communicate back to our brain. One of the most important things I teach my clients is if you've ever felt butterflies in your stomach when you're nervous. So that's an example of how you're feeling something in your stomach because of how your emotions were feeling. So that's how strong that connection is. And that connection is always at play when we're digesting our food. And when we're stressed, so let's say, I mean, our normal daily lives, we have stress all the time. And stress is an interesting word because we think of it as like some acute situation that's extremely stressful, but our lives are just filled with chronic stressors that we just to some extent get used to, and maybe we don't even think of as stress. But when you're a mom who's juggling a million things, or you're working and you're juggling a million things, or you're doing both, or you're rushing from one appointment to the next, or on top of it worrying about things, you are in your nervous system's in a sympathetic state, which means it's in fight or flight mode. And that actually blocks, it pinches off to some extent the connection between the gut and the brain. And the purpose for that is to send blood and nervous system signaling away from the internal organs to the extremities, because it's supposed to be for an acute threat so you can run to safety, and then it's supposed to downregulate. But with our chronic stress, we can have this going on to some extent all of the time, pinching off those signals that are supposed to send messages to our digestive tract to digest our food, to move our food through our digestive tract. So I teach my clients that's how important it is to identify and manage our stress. Sometimes I'll teach them how to do some stress management around mealtime. But again, that's where I would hand it off to you and say, what are some things people can do about this?
Yeah, so there are a few things that people can try that I like to educate my patients on and have them implement daily. So one of the most common ones that I have found that's been helpful is the 4-7-8 breathing technique. Have you heard of it?
No.
Okay, well, it's very simple. Anyone can do it. I highly recommend trying it twice a day just to get into a routine of doing it. So when you do feel a lot of anxiety, it'll just come naturally to you and you don't have to be like, oh my God, what should I do when I'm anxious? So it's really easy. You can do it sitting down, laying down, but you just want to basically just sit quietly or lay quietly. And then you breathe in through your nose for 4 seconds. And then you hold it for 7, and then you release through your mouth for 8 seconds. So you can continue this for up to 4 times. And this basically helps to reduce anxiety. It also helps people that have a hard time sleeping at night and have a hard time falling asleep because it just relaxes you. And like you mentioned earlier, it also has an effect on the vagus nerve. We know that it's related to your heart rate, digestion, and your immune response. So by doing this daily, it just makes you a little more, less anxious, relieves stress, and also promotes better sleep. So that's one technique that you can try. Another one that I like to use or teach my patients about is, well, there's a couple. Another one is progressive muscle relaxation. So again, you can sit down or you can lay down, and you want to just be in a quiet place, relaxed. And basically you move through each of your muscle groups and you tense them up for a few seconds. And then, so for example, you can tense up your arms really tight and then you release them. And then you can do that with your thighs, your feet. You want to move down the muscle groups, or you can go up. It doesn't matter. But basically that just releases physical tension and then promotes relaxation. And I'll just talk about one more real quick. There's another one called body scans. And so this one is really easy also. You can do this just in a quiet place. And you sit there and you're just going through each of your 5 senses and just noticing what's happening with each of them. So maybe you have your eyes open or closed, but you just go through each of your senses. You notice, what are you hearing at that time? What are you tasting? What are you feeling or smelling? And this basically allows your mind to stay in the present moment and not worry about what's happened in the past, what you have going on in the future. It just makes you stay in the present moment. So that's another technique that I like to share to ease anxiety and relaxation.
Oh, I love those. Yeah, I had heard of one similar, but I like how you really broke those down to exactly how to do them and what exactly they're doing for your body. What you said about the mindfulness, it brings you out of the past and out of the present. Mindful, one of the things that I talk about with my clients is mindful eating, and it's gaining a lot of popularity when it comes to weight loss, because people who are burned out from the approach of calorie restriction or calorie counting or dieting and all the focus on food. What are the right foods? What are the wrong foods? An alternative approach is like just listen to your body. Your body's supposed to tell you when you're full, when you're hungry, and if you're calorie counting and if you're doing the next fad diet, you're totally out of touch with that. So what you said about really focusing in, how does the food taste? What's the sensation? What's the mouth feel? That's also a strategy for getting in touch with your hunger and fullness, which are hormones that your digestive tract produces when it's calm in that rest and digest mode. So it's only going to work when you first relax, and then you can focus it. It helps you relax to really focus in. Then you can focus on chewing your food, experiencing your food. I think I'm recalling a study, they even did that when you actually experience the food. So I think they broke subjects into two groups, and they gave each group a bowl of M&Ms and said you can eat as many as you want. And they trained one group on mindful eating techniques, taking one M&M at a time, really chewing it slowly, experiencing the flavors and the textures and all of that. And the other group, they didn't give them any specific instructions. And the group that was trained in the mindful eating techniques ate fewer M&Ms overall. So just by experiencing your food and really enjoying it and having the experience versus eating mindlessly. Think about when you're watching TV and you're just eating and then you're like, where did the bag of chips go? By experiencing it, you feel that mental emotional satisfaction, and you actually don't have to eat as much to feel satisfied. I always thought that was so interesting. So what if people try these techniques but they're still struggling with burnout or anxiety? What if it just doesn't seem to be working for them?
Yeah, there's a few things that you can try. If those things still aren't helping, or you're just feeling a lot of anxiety or a hard time sleeping, there are some vitamins and nutraceuticals that you could try. So one that I think that has been really helpful is melatonin. I don't know if you're familiar with melatonin, a natural hormone that we secrete in our brain in the pineal gland. It's a naturally occurring hormone. It's relatively safe to use long term. In pregnancy specifically, there's not enough data, so you might want to explore alternatives. But for most people, 3 to 5 milligrams a day is helpful for taking it before bedtime. There actually is a new study, or recent studies have shown that a microdosing of it has been helpful. Less than a milligram 30 minutes before bedtime has been shown to actually help with falling asleep. And a lot of my patients, for some reason, they keep increasing it, and some of them are at 15, which is high, but usually you want to be between 3 and 5. And so I tell them, why don't you try to microdose and see if that helps? Because when you keep taking too much, it doesn't have any more effect anymore. So they've tried it and it's been really helpful. That's one thing that someone can try to try and relax if they have anxiety, especially at nighttime. Another one that's pretty helpful for people is magnesium. And this one is safe for pregnant and postpartum women. This also promotes relaxation, helps with sleep, anxiety. And usually if you take between 75 and 360 milligrams a day, that'll be pretty helpful for that. So those are a couple things that I would recommend to individuals who've tried these different breathing techniques or relaxation techniques and maybe want to try something over the counter. This might be helpful for them.
Okay. So then what about medications?
So medications, okay, after you have tried all that and you're still experiencing a lot of anxiety, depression and anxiety are under the class of SSRIs. So that's selective serotonin reuptake inhibitors. You don't need to know that, but those are the first line medications that we use. And so those ones help. If you take them daily, you'll feel some improvement within 4 to 6 weeks usually. But in the first week or two, you might have some GI issues. So some people complain of diarrhea, constipation, appetite changes, which is common. And I think maybe you can speak more to this, but because it's affecting your microbiome and your body's adjusting to this new medication that's in your body. But it usually goes away after a couple weeks. And then you'll start to feel some improvement in your mood and anxiety. But also, a lot of people don't know that serotonin isn't just in the brain, it's also in your gut. So that's why that has a lot to do with side effects, temporary side effects usually.
Yeah. I think it's 90% of serotonin is actually produced in the gut. And so serotonin is one of the chemicals that really helps with mood. So not only does it help with mood, but it also plays important roles in gut function, like gut motility, how full and hungry you feel. So that's what you're talking about, the side effects that can happen when you're first introducing it externally and your body's trying to rebalance. But that's interesting. And I do have IBS clients that are surprised when their doctor tries prescribing an SSRI for their IBS because maybe they've tried some other medication to more directly target the symptoms first and foremost. But a lot of doctors recognize that actually addressing the underlying, whether it be suspected or confirmed depression or anxiety, or whether they're just addressing this role that serotonin can play in the gut symptoms.
Oh, that's interesting. Yeah.
Yeah.
I didn't know that.
Yeah, I do see that. And then how important would you say sleep is when it comes to stress?
Oh my gosh, it's huge. If you don't have good sleep, it's really going to affect the following day that you have. You might have low energy, you might feel sluggish, you're not going to be able to concentrate. So having adequate sleep, which is usually for an average person is 7 to 9 hours, is really big. So that can also, of course, reduce stress, reduce anxiety, because you'll feel more energized and just be able to think clear. I do teach some sleep hygiene, and some of that includes, I think you can agree with this, avoiding a large fatty diet right before sleep or so close to bedtime. I think that can help a lot. Do you take naps in the daytime? Sometimes people take really long naps, but you want to try to limit it to 20 to 30 minutes just so that it doesn't affect your sleep cycle at nighttime. So it's like a power nap, like 20 minutes is good. Of course, limiting caffeine and alcohol, especially close to bedtime, could be helpful. Trying to go to sleep. Well, before you go to sleep each night, you want to try to have a relaxing routine, whether that's a skincare routine or taking a hot or a warm bath, something that's more relaxing. And then trying to sleep at the same time each day, waking up at the same time each day, having routine and consistency can really help with your circadian rhythm and your sleep cycle. Using the bedroom for only intimacy and sleep. So no TV in the room. Before sleep, you want to avoid screen time. So no TV, no iPad and iPhone, which I know is really hard because people like to wind down after work and just scroll, but it's really hard because your brain is making melatonin at night, which signals to your body it's time for bed, but your brain doesn't know the difference between the sun being out and your screen. So your brain's like, oh, it's time to be awake. That's why we want to try and limit that. And just preparing your room to be a relaxing, cool, dark place, just setting your environment up so that you can fall asleep and then stay asleep. Those are just some things that you can try to get better sleep.
Yeah, and that's so important because with gut health, sleep deprivation affects it can affect the hormones that you produce, especially the hormones of ghrelin and leptin, which are involved in appetite and metabolism. Statistically, the people who, for example, work the night shift, they have a much harder time in general with weight management because they could eat the same number of calories, or it could be harder for them to eat the right number of calories because their hunger and fullness are affected. And it also affects their metabolism. I know, like my sister used to be a night nurse, and so she could attest to that. She gained weight even without really changing her eating habits. So that's one issue. And then sleep also, deep sleep deprivation or not enough sleep impacts our immune function. So that has an effect on our gut because 80% of our immune system's lining our gut. And even just the stress response, right? So when you haven't had enough sleep, your body's in a stressed mode. So again, it's activating that cortisol, that sympathetic nervous system that we talked about. So it's so important. So those are awesome tips. about sleep. And it was so interesting what you said about the melatonin too, because which applies to this sleep topic as well. So less is more sometimes, right?
Yes, less is more sometimes. In this case, I think it is. Oh, I actually just had a question for you. I really loved what you said about just being more mindful about eating. And I feel as a mom or just any busy woman, I know you have a lot of women clients too, or just anyone that's super busy. What do you suggest to them if they're so busy they don't have time to maybe mindful eat all the time?
Mhm.
What are some suggestions that you have that I can bring back? Or that makes sense. Because I'm over here trying to make dinner for these two kids. I don't have time to eat and be mindful, but I'm wondering if there's like small things that you can suggest.
Yeah. Well, it's interesting you brought up the 478. I guess I learned 444, but I don't know if it matters. You can
Mhm.
tell me if the number matters. I do tell my clients before you eat, take 2 minutes and do that slow, deep breathing because that helps to deactivate the sympathetic nervous system and activate parasympathetic. So you're talking about a scenario where your kids are there and you're rushing. So that ideally you'd be able to do that. 2 minutes is not very long, but let's say that's not always possible. So you had mentioned that technique. And does it matter the amount of time? Is there like science behind the 478 or 444?
I don't think so, but don't quote me on that. I think it's more
Yeah,
about slowing your breath down, however many seconds that is. I,
yeah, I agree. I think it's the slowing down that really makes the difference. Here's a couple ways to help you digest your food better. One thing you can do is smell each bite of food before eating. So if you think in some cases, I've even told my clients, get a slice of lemon and smell the lemon before you start. Don't smell the lemon wedge or if there's lemon in your water. Because think about when you smell something sour and you salivate. And also when you smell it, if you walk into the kitchen, something smells good, you start to salivate. And when you salivate, your digestive system salivates. That same
Mhm.
mechanism, it starts in your brain. It starts with smelling, and your whole digestive system is gearing up to digest your food. So your stomach starts releasing acid, your pancreas starts releasing enzymes, and your gallbladder starts releasing bile. So that is happening when you salivate. So you can smell each bite of food before putting it in your mouth. I'm a big fan of chewing well. I would say probably none of us are chewing enough unless we're deliberately trying to. I know when I first started to chew better, I was probably chewing 10 or less times before I would swallow my food, and we're really supposed to chew 30 to 40 times. So that's like your
Weird.
ABCs, say all your ABCs, then now I know my ABCs. Next time, won't you sing with me? That's 35 times. You can count or you can do the ABC trick, but that's really important because that's starting the mechanical breakdown of your food and it takes a lot of the burden off of your actual body's digestive tract to take it from there. The other thing, one more tip with that, you can try to avoid downing a bunch of water or beverage with your food because I know it can be hard to hydrate throughout the day. So a lot of people tend to drink a lot of their fluid with their meals, but that dilutes your digestive secretion. So it's actually not something that you want to do. I would try to drink fluids between meals and you don't have to strictly as a rule not drink with meals, but I would try to just sip here and there. And also if you're chewing your food well enough, that causes saliva production and moistens it. So you shouldn't have to feel like you're washing down your food with a lot of water.
That's so interesting. I didn't know that. Okay, I'm gonna try that
Yeah.
because that's definitely not what I've been doing.
Yeah. Yeah,
Okay.
try it when you're chewing and you're trying to chew 30 to 40 times. You really have to resist that swallow reflex because it's natural. You'll just try to swallow it and you'll have to swallow, but leave the food in your mouth and keep chewing.
Oh, okay. So if I do those things, then my body will be able to digest better.
Yeah,
Oh,
even if you're a little stressed. Yeah, so
okay.
ideally we would de-stress every time, but that's just not realistic.
Okay.
What do you think? And I have a follow-up question about what you said, because another thing you mentioned is the blue light, the light from our devices, our electronic devices, and how that simulates sunlight and how it confuses our body and keeps us awake. So what do you think of the blue light glasses? Is that a good potential solution? Have you heard of them?
Oh, is that the one that kind of blocks the blue
Yeah,
light.
yeah. I think they're called like Felix blue light glasses, and you can put them on while you're watching TV, and it's supposed to block the blue light.
I think I would, I'm not too familiar with that, but when I think about it, I think it's more also about just not stimulating your brain. So if you're going
Mhm,
to read, I suggest reading an actual book if that's
mhm,
relaxing to you. I
mhm.
think any screen is going to be stimulating or if your brain is changing every few seconds if you're scrolling, I would suggest just being off of electronics regardless. I mean, maybe that's good for you earlier in the day, but just prior to
Mhm.
sleep, I would probably not suggest that.
That's a good point. Yeah, that's a really good point.
Yeah.
Well, so what would you say to women who are struggling with either IBS or maybe just stress or anxiety in general? Any last words of encouragement?
I think that they have a great person to go to for IBS with you. I've learned so much today. I can't wait to bring this back to my other patients that I have because I really didn't know that much about the gut health besides how medication is part of it. But I think that there's so many techniques that you can do to help in the anxiety because still what I go back to from what you said is when people have to count calories or they're putting it into an app, I just remember feeling so stressed, like this is overwhelming. I don't want to do this. I don't want to learn about this because it's just it's a lot. So you breaking it down a little bit easier today was really helpful. And I think that the education that we have and the techniques that we've talked about today, I think that it's really going to help women or people that have anxiety around eating and IBS and all that. So I really appreciate you and
Yeah.
sharing all that with me today.
Yeah, I just think we're never going to be perfect, right? And we're never going to be able to control the fact that there's stress in our lives, but we can mitigate how that affects our bodies and then also just how it affects every other aspect of our lives. I so appreciate your insights, and we will have all your information in the show notes. So thank you so much for being with us today.
I had so
Awesome.
much.
That was really
Thank you so
good.
much for having me. Great.
You're welcome.